Hello, my name is Dr. Jessica Lofgren. Today we are joined by Dr. David Traster. Dr. Traster, how are you doing today?
Doing great. How you doing?
I'm doing pretty great. So I brought you on here today because we are talking about this year's International Symposium of Clinical Neuroscience. You're going to be there this year, and we're excited to have you there.
Well, thanks so much. I'm so excited to be there.
So for some of our scholars that might not know you, can you tell us a little bit about yourself?
Yeah, no problem. So I came up through the Carrick Institute. As a student, I learned under Dr. Carrick, and I learned a lot working with him both in the classroom and in the clinic. And now it's an honor not only to teach for the Carrick Institute, but also to be invited to speak at the ISCN. I just enjoy the ISCN as a learner because every year you go and you hear different type of clinicians and researchers, and sometimes at face value, you think, how do these people connect? And then you go and there's synergy in all the speakers, even at surface, sometimes you don't think there may be. So it's always experience, it's always amazing, and there's always so much to learn from some of the top people in their field.
Yeah, that's a beautiful way to put it. So many different professionals and experts coming in and sharing. It's going to be an amazing time this year. So you're speaking at this year's International Symposium on Clinical Neuroscience. What topic did you choose to present this year, and why did you pick that topic?
So I chose to talk about different types of electricity to interact with the brain. We know through thousands of years from Egyptians, Greeks, Romans, people have used this type of electricity. So we want to look at how they used it then compared to how we use it now, the different types of electricity, because there's a lot of different types, and maybe more than people think, and different reasons to use it, whether it's pain, whether it's cognition, whether it's memory. And if we know anything about the history, we know in 10, 15 years from now, you probably won't use it because it comes in waves, but we're going to look a little deeper and say, is this going to last longer than it has in the past? And can we use it therapeutically?
So it sounds like a very clinically relevant topic for a lot of our scholars. Sounds like they're going to be able to take a lot out of what you're talking about and apply it in their practice. So that's really exciting to hear.
Absolutely. I'm coming from a clinician. Everything I want to do, I want to have some clinical relevance.
Exactly. So if you want to hear more of Dr. Traster's talk, make sure that you attend the International Symposium on Clinical Neuroscience happening May 24th to 26th in Orlando, Florida. Dr. Traster, thank you so much for taking time out of your busy schedule to join me today on this call. We look forward to seeing you next year at the symposium.
Thank you so much. Have a great day.
You too.